In 2010, under the direction of Rabbi A.B. Ingber, the Xavier University Center for Interfaith Community Engagement launched its Interfaith Medical Service Trip. Each year, 12 students travel for 1 week during their spring break to help establish community-based healthcare in rural villages in Guatemala, under the direction of a team of medical professionals.
We bring with us to Guatemala 4 of the most beautiful medical professionals in the entire universe. Our medical director, Dr. Lori Kramick, who's our pediatrician. Dr. Richard Walter, who flies in from Los Angeles to serve as our internist. Nurse Stephanie Bemery, who not only was a student participant on the trip, but now really soars as our triage nurse and a senior educator for our students. And Eric Bertelsen, our pharmacist, who is just such a kind and generous soul and a wonderful teacher to students. I don't think that any of our nurses or doctors will ever have an opportunity, as they have in Guatemala, to learn from people who are so devoted to their field, but also so wonderful in their hearts.
Prior to the trip, the team spends months training and learning about the challenging situations they will encounter.
I can't tell you the amount of training that they have coming out of this from our medical education meetings in terms of vital signs and blood sugars and growth curves. It's real hands-on skills that they're going to use or will be useful in their actual career.
They also work to raise funds and collect donations, bringing over 1 ton of medical supplies with them. During the course of the trip, students work across a number of different areas, from triage, to pediatrics, internal medicine, pharmacy, and even distributing eyeglasses. Throughout the course of the week, the team helps to treat more than 200 patients. Their work is a partnership with local leaders who will continue educating community members after the team leaves, with the long-term goal of establishing a self-sustaining clinic. But the impact of the trip isn't just in the communities of Guatemala.
What I see time and time again is how much this trip transforms them into really wanting to become a healthcare professional who is motivated to serve those who are marginalized in our world.
We as medical professionals have a great duty to inform our community about those things that they can do to take care of themselves better. And I credit the trip to Guatemala with opening my eyes to that. I don't think that I truly understood the power that I have within myself and the power that we are now instilling in our students to say, you do have a voice to changing the outcomes of your community members. And you can do that now. You can do that as a part of this trip. You have the ability to change one person's life. And in return, you change your own life. You change your own trajectory. I would have never thought I would be getting a PhD in nursing research, but here I am. And that is thanks to the Guatemala Medical Service Trip.